Hello, everyone, and welcome. My name is Eileen Nicoletti, and I'm the Medical Director of the Pyruvate Kinase Deficiency Gene Therapy Trial sponsored by Rocket Pharmaceuticals. It is my pleasure to share with you today some information on our ongoing study for adults and children with severe PKD. Pyruvate kinase deficiency is caused by a mutation in the PKLR gene, which encodes for the enzyme pyruvate kinase. The pyruvate kinase enzyme is used by red blood cells to produce energy, also known as ATP. As a result of the deficiency, red blood cells cannot generate sufficient energy, have a decreased lifespan, and break down more easily. Increased red blood cell destruction, or hemolysis, as it is often referred to, results in anemia and many other clinical symptoms, such as jaundice, that PKD patients experience. Gene therapy involves the insertion of a functional gene into patient cells with the hope that the functional gene can manufacture protein that functions normally, which in this case is the pyruvate kinase enzyme. Gene therapy is a technique that involves the insertion of a functional gene into a patient's cells in the hope that the functional or correct gene compensates for the abnormal gene. It uses a virus, which is disabled so it cannot reproduce or cause disease, to deliver the normal gene. The virus carrying the normal gene is known as a vector, and the viral vector can be delivered either into the body, which is referred to as in vivo gene therapy, or into cells that have been removed from the patient and transplanted back into the patient after the cells have been genetically modified. This is called ex vivo gene therapy and is the type of gene therapy that we're using in the current trial. Gene therapy has been shown to be a potential treatment for PKD in mice models of the disease. The primary purpose of the current study is to evaluate whether or not PKD gene therapy is, one, safe in PKD patients, and two, to see if there are any preliminary signs of disease improvement. The goal of the gene therapy in this clinical trial is to insert a functional copy of the PKLR gene into patients' hematopoietic stem cells, which are the cells in the body that reside mostly in the bone marrow and produce red blood cells as well as white blood cells and platelets. Following administration of a medication called Busulfan to make space in the patient's bone marrow, the genetically modified cells will be infused through a large vein. The hope is that the new cells will engraft or grow in the patient's bone marrow and make red blood cells that contain the functional pyruvate kinase enzyme, enabling them to survive and function normally, reducing or eliminating the anemia that patients with PKD experience. So how does Rocket's gene therapy work? As I mentioned, this gene therapy approach uses an ex vivo approach with a lentiviral vector intended to treat patients with PKLR mutations. Blood stem cells are pushed from the bone marrow into the blood with special medicines that the patient receives through subcutaneous injections, and then collected from the patients via a procedure called apheresis, which I will explain in more detail in subsequent slides. The stem cells are then genetically modified in a lab by introducing a functional copy of a PKLR gene using a viral vector. The viral vector, in this case, is the lentiviral vector. The patient is then given conditioning treatment to prepare to receive the genetically modified cells with a chemotherapy called Busulfan. and then the genetically modified stem cells or blood-forming cells are returned back to the patient through a large IV. While gene therapy trials similar to this study have been conducted in a number of other diseases, this is the first in human trial for PKD. As I briefly mentioned, the purpose of the current study is to determine the safety of gene therapy, which has first been evaluated in adults and is currently being evaluated in adults, and then in pediatric patients, and to look for early indicators that the therapy is effective. There are 3 age groups or cohorts of patients that are being evaluated in the current study. As I mentioned, 2 adult patients have received therapy on the study and are undergoing follow-up. We are currently enrolling older pediatric patients ages 12 to 17 years, and then plan on enrolling 2 younger patients ages 8 to 11 years once we have additional confirmations of safety and preliminary efficacy. To be eligible, patients must also have severe and/or transfusion-dependent anemia, which we are defining as having at least 6 red blood cell transfusions episodes over a prior 12-month period, or at least 3 red blood cell transfusion episodes per year over 2 years, and hemoglobin levels less than 9.5 grams per deciliter in the previous 12 months, despite having a prior splenectomy. Adults and older pediatric patients may also be eligible if they have hemoglobin levels less than 8 grams per deciliter in the absence of transfusions, despite having their spleen removed. Participants must also have adequate organ function, including heart, lungs, liver, and kidneys. Reasons why some patients may not be considered for trial participation include if they have other known causes of red blood cell breakdown, history of blood clot, stroke, or heart attack in the previous 12 months, liver disease, including cirrhosis or active hepatitis, significant medical conditions, active cancer, uncontrolled seizure disorder, poor heart function, poor function of other organs, or taking another investigational drug, or are pregnant. In order to determine if a patient is eligible, the clinical trial physician will take a thorough clinical history, perform a physical exam, and conduct a number of blood tests and other assessments to further assess if the patient meets the criteria for the study and if the patient is deemed a good candidate to undergo the study procedures required. The PKD gene therapy clinical trial has 4 key components that I'll review in greater detail in subsequent slides. The first part of the trial is the screening period, in which the patient or parent or guardian provides consent to participate in the study. Once a patient is deemed eligible for the study, he or she will then undergo stem cell collection to manufacture the gene therapy. After the gene therapy product is manufactured and quality testing of the product is complete, the patient will then be readmitted to the hospital to receive chemotherapy as a preparative regimen, and then the gene therapy product. Once the patient has received gene therapy treatment, the patient will continue regular follow-up for 2 years on the study. As I mentioned, following provision of informed consent, the first step in the gene therapy trial is the screening period. Screening takes approximately 1 month to complete and likely will require approximately 2 weeks at the clinical center to complete the necessary tests to determine if the patient is eligible to participate in the study. Tests that will be done include routine blood tests to check blood counts, iron levels, kidney and liver function. Additionally, imaging will be done to evaluate iron content in the heart and liver, and a sonogram to check heart function will also be performed. Tests to assess lung function will be done, and bone marrow testing, in which a needle is used to take a bone marrow biopsy and a sample of bone marrow, will also be performed. These tests will be conducted under anesthesia in most cases, particularly for younger children enrolled on the study. The treating physician will provide more information regarding the tests and inform the patient and guardian or parent of the risks and benefits. Following determination that the patient is eligible in the study, is eligible for study participation, the patient will undergo collection of the blood or hematopoietic stem cells. The stem cell collection process takes approximately 1 week and requires inpatient hospitalization for at least a portion of that time. In order to collect the stem cells, the patient is given several days of subcutaneous injections of medications called G-CSF and plerixafor, which help to move the stem cells from the bone marrow into the patient's blood. This process is called mobilization. On the 5th and 6th days after receiving these medications, the patient's blood will be collected through an IV, inserted into a vein in the arm, and passed through an apheresis machine, which separates the stem cells from the other blood components. The remaining blood will be returned to the patient through another IV. Some patients, especially children, may require a special IV called an apheresis catheter to collect the cells. This special catheter is inserted by a surgeon while the patient is under anesthesia. Once the stem cells are collected, the apheresis catheter is removed and the patient is discharged from the hospital. The collected stem cells from the patient are then sent to the lab and genetically modified or transduced with a normal copy of the PKLR gene using the lentiviral vector. Once this transduction step has been completed, the gene therapy product undergoes quality checks, and this process takes approximately 12 weeks. After completion of the gene therapy product quality testing, the patient is then readmitted to the hospital. The patient will have blood work done and a special IV called a central catheter placed in a large vein, which will be used to deliver a type of chemotherapy called Busulfan over 4 days. The Busulfan is given to remove the stem cells with the PKLR mutation and make room in the patient's bone marrow for receiving the genetically modified cells. Routine blood tests will be performed daily to check the patient's blood counts and organ function. Other blood tests will also be performed to check the levels of Busulfan and decide whether or not the dose needs to be adjusted. The potential side effects of Busulfan conditioning will be discussed by the principal investigator, also known as the treating physician, in greater detail during the informed consent process. Common side effects, however, do include hair loss, mouth sores, and nausea or upset stomach. Medication will be given to prevent or alleviate the side effects of Busulfan conditioning. Infertility or the inability to become pregnant or father a child is an important concern many patients and families have, and a known side effect of busulfan. The treating physician will discuss this with the patient and family and will be able to refer the patient to other healthcare professionals to understand what fertility preservation options might be available. Following the administration of busulfan, the patient will receive the gene-corrected cells by IV infusion through the catheter, similar to a blood transfusion. The patient will remain in the hospital being closely monitored for approximately 4 to 6 weeks until the new stem cells engraft in the bone marrow and start making new blood cells, including red blood cells, white blood cells, and platelets. This process is called engraftment. Once this has occurred and the patient has recovered from the side effects of chemotherapy, he or she will be discharged from the hospital. The patient will receive regular follow-up testing for 2 years post gene therapy administration. Follow-up will be more frequent during the first 3 months after discharge from the hospital, and the patient will likely be asked to stay close to the clinical center during this time. After 3 months, visits will occur every 3 months for the first year of the trial, and then every 6 months during the second year of the trial. In addition to a clinical history and physical exam, the patients will have regular blood tests performed and bone marrow assessments done at more limited time points. What are we hoping to evaluate with our study? We want to assess whether or not the gene therapy is safe. We'd like to look at and understand if there are gene-corrected cells in the peripheral blood and bone marrow, and whether there is a reduction or elimination of blood transfusion requirements when applicable. We'd like to see whether or not the gene therapy results in an improvement of anemia, and if there is reduced red blood cell breakdown. To find out more information regarding our study, please email our patient and family advocate at pkdclinicaltrial@rocketpharma.com. Additionally, you can also visit the Rocket Pharma website for resources for patients and families affected by PKD. Videos about PKD and our past patient and family event can be found on our YouTube channel. And finally, additional details regarding the PKD trial can be found on clinicaltrials.gov. Thank you very much for your time and your attention.